Hello and welcome to Building Strength webinars. Thank you for joining us today. My name is Dr. Katherine Neubauer and I'll be speaking with you about the good news about how cancer can be preventable. And I'd like to thank Dr. David and Sherry for inviting me back to speak. Last time that we met, we talked about a practical approach to using the benefits of antioxidants during chemotherapy. And many of you have since written me and asked, what can I do to protect my family from the suffering and difficulties of cancer? And so I'm here today to share good and empowering news about ways that you can protect your family. Thank you so much for joining us, and I will be taking questions during this talk, so as you have questions, please type them into the chat field, and then I will address them either in the middle of the talk or the end of the talk. And we'll go ahead and get started. So first of all, I want to start off by talking about cancer prevention. And a lot of patients that I talk with get very discouraged about that idea because they've heard that cancer is all genetic. And that is partly true. That is to say that genetic damage to healthy cells is part of the key process of cancer formation. Where I think people get misled or confused is in understanding that word genetic, because that can mean inheritable, that is the genetic material you get from your parents, or it can mean changes to your normal DNA throughout the course of a lifetime. And so we're going to clarify that difference and empower you to take control of your own genetic destiny. Other reasons that my patients get discouraged is that they've learned that cancer runs in their family, and so they feel that there isn't anything that they can do. And we'll talk about two features with that. One related to really what proportion of cancers do run in the family, and then also talk about the ways in which you can control the expression of the genes that you inherit. And just a little bit about my background and skills. I practice naturopathic oncology in Tulsa, Oklahoma. And what naturopathic oncology is, it provides practical, integrative, and natural medicine care for people who are living with cancer or people who are interested in cancer prevention. And we do this rooted in the healing power of nature, that is the knowledge that the body has the capacity to heal itself if given the right tools, which nature beautifully provides. And also doing this rooted in the principles of naturopathic medicine. If you'd like to read a little bit more about me and my background as a naturopathic doctor, there's a website there. And then also, if you'd like to learn more about naturopathic oncology, I'd encourage you to visit the Oncology Association of Naturopathic Physicians at that website, oncanp.org. So let's get started talking a bit about genetics and lifestyle and cancer care. And we're going to clarify the fact that while almost all cancers are genetic, less than 10% are inherited. And that's a little bit confusing because folks think, well, if it's genetic, of course I inherited. Well, where that confusion comes up is that the reason that cancers are genetic has to do with the tumor's genes, not the genes that you got from your parents. So you start out with healthy cells, and then there are a variety of environmental and lifestyle factors that occur, things like an inflammation or infection or nutrient deficiency or toxins, and those things can damage DNA in your healthy cell genes. And those healthy cells can then go through some changes, possibly form cancer cells, and those cancer cells then have that genetic damage that drives their behavior. So notice then that we're talking very specifically about genetic material that's shaped by lifestyle, not genetic material that's inherited. And where some of this really provocative data is coming from particularly are some scientists at MD Anderson under the leadership of Dr. Agarwal, and they've been looking very closely at the relative contribution of genes versus the environment in cancer development, and also have been looking at what we can do about it. They've particularly focused on issues related to inflammation and the expression of a protein called NF-kappa B, and we'll talk about that more later in the talk. So I want to give them quite a deal of credit. Many of the images and facts from this presentation have come from some of their papers. One paper I particularly encourage you to read, the citation is on this page, and it was published in the Journal of Pharmaceutical Research. For those of you who are interested in turmeric or curcumin, they are also one of the world's leading labs looking at the questions of influence of curcumin on cancer. So with that background, what these MD Anderson scientists found was that in reality that 5 to 10% of cancers can be attributed to genetic inheritable situations, and that the other 90 to 95% can actually be attributed to the environment. And that's in terms of the percentage contribution of each risk factor. And so we'll break down a little bit more what we mean by the environment and what the contributions are. But that's a pretty striking figure to be able to look at that and say, wow, 90 to 95% of cancer risk may be within my control. So let's talk about the truth about genetics. Far from being all genetic and all out of our control, you can actually see at the top there what the real piece of the pie is, with the vast majority being the environmental factors and a very small proportion being genetics. We'll go into more detail on each piece of these images in the next few slides. One way to clarify the role of genetics in cancer prevention or cancer risk is to look at what we call twin studies, studies of identical twins and their health. Because identical twins share 100% of their genetic information, what happens to them in their health can tell us a lot about the genetic contribution to disease. And so it's really interesting in the case of breast cancer, if one identical twin female is diagnosed with breast cancer, the likelihood that the other twin will get a breast cancer diagnosis is only 20%. So if cancer was all genetic, we would expect 100% contribution there. So at most in these studies, we're seeing a 20% genetic component. Keep in mind, though, that twins, depending on how they're raised, may also share lifestyle factors. So the true number of genetic contribution may be even less than 20% in this case. So let's talk a little bit about the cancers that are most inheritable, most genetically linked in the traditional sense. And this diagram shows them, and they are testicular cancer, thyroid cancer, laryngeal cancer of the head and neck area, and multiple myeloma. Now, the reason it's interesting to get specific on that is notice the cancer types that affect the majority of people. The most common cancers are not these genetic cancers. They're the more lifestyle-linked cancers like breast, lung, colon, and prostate. And so we can say, as a generalization, that truly inheritable genetic cancers are actually much rarer than cancers related to environmental factors. And if you're curious about how these numbers were created, the clipping from the study down at the bottom describes how these numbers were developed. So then let's talk a bit about the environment, about the key risk factors that can contribute to your cancer risk. Some of them will be, I imagine, very familiar to you, such as tobacco, which comes in at 25 to 30%. In researching this talk, it surprised me that food and diet actually exceeded tobacco by a little bit at 30 to 35%. We'll talk about infections that you may be less familiar with and their contribution of 15 to 20%. And we'll also discuss the role of obesity, particularly abdominal obesity and its role in insulin resistance, and the contribution of alcohol. So starting off talking about tobacco, I think it's not news to anyone at this point that smoking causes cancer. However, there may be some pieces of information in here that are new to you. For example, you know, it can often be awkward to ask someone to not smoke around you, and smokers sometimes may be resistant, suggesting that there's no impact on your health to secondhand smoke other than it being unpleasant. And so I found it very interesting that our government classifies secondhand smoke as a group A carcinogen. That is something that is clearly known to cause cancer. So don't be shy about asking people not to smoke around you. There used to be the public advertisements out where a gentleman would say, "Mind if I smoke?" and the person next to him would say, "Care if I die?" And while that's humorous and perhaps exaggerating the point, I think sometimes we need to be a little bit more direct about what secondhand smoke is doing to us. Now even third-hand smoke is being documented as a carcinogen, and third-hand smoke is the carcinogens related with smoking that track on objects like people's clothing. So for example, if your coworker goes outside for a smoke, she's not even around you, comes back to the office, she just smells of smoke and it's bothering you. That's not just a matter of your opinion, it's actually toxic to you. There is carcinogens related to smoking that are on her jacket that can affect you. And we know that tobacco contains at least 50 carcinogenic substances, and of particular interest to audience members who are studying up on hormone therapy, note that tobacco contains the heavy metal cadmium that mimics estrogen. Next, I want to talk a little bit about alcohol. This slide goes over the cancers that are influenced by alcohol intake and the relative contribution to them. Also shows at the bottom the contribution of smoking to cancer risk. You can see that smoking is overall much more significant than alcohol. However, alcohol does have some substantial contribution. And there are several ways in which alcohol contributes to cancer risk. Alcohol is what's called a procarcinogen, that is, alcohol itself does not cause cancer, however, what the body makes out of the alcohol does. The liver converts alcohol into acetaldehyde, which is carcinogenic. Secondly, alcohol use can induce nutrient deficiencies, and particularly of some of the B vitamins and minerals, which I've listed here, as well as vitamin E. And so, as you expect, alcohol has a direct effect on tissues that it touches in the upper and mid GI tract, so the esophagus, the stomach, also the liver. And then some surprising new research has found that alcohol use is linked to breast cancer in women as well, increasing the risk. And particularly with the breast cancer risk, they found what's called a dose-response relationship. That is, with each additional drink of alcohol per day, the risk of breast cancer increases in a stepwise fashion. And so right now I think reasonable safe use advice for men and women is for men to have up to 2 drinks daily, and women should consider 1 or less daily, and that's on the basis of the impact of alcohol on breast cancer risk. Certainly alcohol does have some beneficial effects as well in terms of resveratrol and other flavonoids that are in alcoholic beverages. Beer has some data as far as being a good source of silica in bone strengthening, so we have to weigh risks and benefits, but I think overall, in looking at the risks and benefits, these safe use guidelines are what I would advise. Next, let's look at the diet piece, and this slide is just beautiful what Dr. Agarwal has put together as far as the contribution of diet to cancer risk in a variety of types, and you can see here some of the ones that are most substantially contributed. For example, colorectal cancer, 70% of cases linked to diet, prostate cancer, 75%, breast and endometrial cancer, 50%. So the good news here is that a substantial part of cancer risk for a variety of the most common cancers, that is the colon, prostate, breast, and even lung, are impacted by diet, and so that puts quite a bit of power back in our control. So we're going to talk about 2 pieces with food and cancer risk. One is the damaging things that can be had in food, and that'll be the first part of this talk, and then later in this talk I'll go into great detail as far as the benefits from food in terms of decreasing your cancer risk. And so some food carcinogens are listed here. At the top, meats, particularly when they are char grilled or smoked, basically when the meat is burned, that produces heterocyclic amines. These are the same kinds of chemicals that are present in exhaust from automobiles, to give you an idea. So these very carcinogenic substances. There's been some interesting in vitro data related to this, where the meat was soaked in green tea or vitamin C before being cooking, and the production of these heterocyclic amines was reduced. So that's something to consider as well. Other food carcinogens, pesticides. We spoke in our last talk about the Environmental Working Group and the fabulous resources that they have as far as pesticide avoidance. They have an iPhone app and also a wallet card that'll show you the fruits and vegetables that are highest and lowest in pesticides, and that can help to guide your organic fruit and vegetable choices. Dioxins can happen in food, and these can occur both from local industrial contamination. They also can occur from using bleached packaging. For example, if you go to Starbucks and get your coffee in a bleached coffee cup, know that potentially some dioxins can be getting back into your food. So I encourage my patients to get a reusable ceramic cup and help out both themselves and the earth at once. Next, there's been a lot of talk in the news about bisphenol A, which is what makes plastics softer, And so I think many people are aware of that in relation to, for example, avoiding bottled water. Some pieces that have come out as new information recently: packaged foods, particularly microwave popcorn, is an excellent source of bisphenol A. They coat the lining of the microwave popcorn bag in order to avoid it sticking. Many canned foods, the cans are lined with bisphenol A also to prevent sticking. Um, and I've checked in, some organic canned food manufacturers are avoiding bisphenol A by coating the can with an enamel lining, so you might check into that with your favorite foods. I looked into it, for example, with some stewed tomato products that we use for making soups, and was pleased to find some enamel alternatives. Found it very interesting that in Agarwal's study he cited refined sugars and flours as food carcinogens. Disappointingly, he didn't cite the sources for that information, so I think that's certainly something that's going to be interesting to look into further. And then furthermore, dairy products have an interesting potential carcinogen in them called insulin-like growth factor 1, also called IGF-1. And IGF-1 is an excellent thing to have if you are a little baby cow who needs to grow quickly. In us as adult humans, though, we don't have a need particularly to rapidly grow new tissues other than to potentially provide a growth signal for a nascent tumor cell. So it may be worth reconsidering our use of cow dairy. Fortunately, there are many good alternatives. We talked in the last conversation that we had about nut milks, about how you can make your own non-dairy milks from things like almonds or pecans or walnuts. Certainly soy milk in moderation, and we'll talk about soy more in a little bit, can be good options as well. So that covers food carcinogens. Next, let's talk about obesity. And obesity is a significant risk factor for a variety of cancers overall. All cancers, obesity contributes to 20% of all cancers in women and 14% of all cancers in men. You can see it affects a variety of body systems. And a lot of that has to do with where your obesity is. We're finding, you may have heard about apple versus pear-shaped bodies and how it's better to be a pear than an apple, where the pear-shaped body keeps the fat around the thighs and upper legs, and the apple shape has it around the midsection. And what we're finding is that in particular, fat that's deposited around the abdomen, wrapped around the abdominal organs, actually acts as a hormone factory. So we used to think that fat cells were just inactive bags of fat. We've since learned that they make a variety of hormones and inflammatory factors. We talked a little bit about insulin-like growth factor 1 in dairy products. Fat cells make your very own insulin-like growth factor. Fat cells also make insulin, so people can get into a vicious cycle with insulin resistance where it all can start out with a poor diet of a lot of refined carbohydrates. With that, a person has a poor glucose tolerance, develops insulin resistance. With insulin resistance, a person will gain weight around the abdomen, and then with that gain of the fat cells around the abdomen, that actually further exacerbates the insulin resistance through the hormones that fat cells secrete. So I work quite a bit with my patients on reversing insulin resistance, both for cancer prevention and also to address conditions such as prediabetes, polycystic ovarian syndrome, infertility, many things there. So there's a lot of good that can be done around addressing this issue of insulin resistance. Fat cells also increase a hormone called leptin. They release sex steroids, so when we talk about hormone balancing in men and women, it's important to keep in mind the role of body fat with that. They further insulin resistance, and fat cells actually cause inflammation. So the more fat that we carry around in our bodies, the more inflamed we are. And we're going to talk about how inflammation in particular is a powerful tumor cell growth stimulant, as are IGF-1 and insulin resistance. And those three factors together help us to understand how obesity can cause cancer. And so insulin and also leptin and tumor necrosis factor, these all things increase inflammation and switch on tumor cell growth. And I know we're going through a lot of information here, so as you have questions or insights, please type them into the chat window, and I'd love to share the conversation with you. We're going to continue on discussing infections and the role of infection in cancer. And you can see that infections are involved in several cancers. Some of these are bacterial, some of them are viral. In relation to genetics in cancer, a new insight in the science recently has been about how microbes can actually give us new genetic material. So a large portion of our DNA actually originally came from microbes. You may hear about the quote-unquote junk DNA. Well, it's called junk DNA because it doesn't get transcribed into your genetic material. However, and it looks like somebody has a question about IGF-1, so I'll get to that in just a moment. So while junk DNA is not transcribed, what junk DNA does do is control how the whole genome is used. We're going to talk in a little bit about epigenetics, and so some of that junk DNA can become the on or off switch for the activation of DNA that can drive tumor cell development. And so infections play a key role there. Some key and what infections affect us vary, of course, by where we live. Here in the United States, some of the main infections of impact are the human papillomavirus, the hepatitis B virus, and the bacteria Helicobacter pylori, which can live in the stomach. And so Deb asks about what IGF-1 is. IGF-1 is an acronym for insulin-like growth factor. So it is a growth hormone that the body makes that acts somewhat like insulin. And its job in a healthy body is to stimulate us to store those calories as tissue, to take the cookie that you just ate and turn it into fat and muscle. And we talked about the fact that in periods of great growth, then that is a good thing, such as in a baby cow drinking its mother's milk. However, in healthy adults who are not going through an acute illness, stimulating growth continuously is not beneficial. And then, so we'll talk a little bit more here about infections. And we talked about the fact that in the U.S., some of the main infections are HPV, human papillomavirus, and hepatitis B virus, HBV. And HPV, most people are familiar with the fact that this is associated with cancers of the genital tract, around the cervix, the penis, the anus. And we are having a lot of new information now about an increase in head and neck cancer cases attributed to HPV. These are cancers of places like the larynx, the tonsils, the tongue. And so now I know many physicians are considering that as part of annual wellness exams, along with swabbing your cervix, doing a pap smear, that they may consider swabbing your throat for HPV, and with the ability to then address that HPV infection potentially before it becomes a head and neck cancer. You know, many progressive dentists are also doing more careful exams, oral exams, looking for head and neck cancer. HBV, or hepatitis B virus, is associated with liver cancer. And in terms of vaccination, good news is that vaccines are available for both HPV and HBV. Whether or not to vaccinate, when to vaccinate, is beyond the scope of this talk today. It really could be a talk in and of itself. If it's something that you're particularly interested in, I would refer you to the wonderful seminars that are taught by Heather Zwicky out of Portland, Oregon. And she really goes into the detail of a decision-making matrix, the risks and benefits, and understand that vaccination is always both a personal and a public health decision that has to be based on the risks and benefits of each vaccine. And Phyllis writes in, she asks, where can you find which fruits and vegetables have the most pesticides and would be good organic candidates? And I had mentioned the Environmental Working Group, or EWG.org, has a wonderful website resource on that. And they have it available both on the website, and then also you can print out a wallet card or use an iPhone or smartphone app for that. And what's great about their data is that all the fruits and vegetables were carefully washed and, if relevant, peeled before they gathered the data. So, you know, a lot of critics of organic food will say, oh, well, all you have to do is wash it to take care of the pesticides. And what the Environmental Working Group found is that it's just not so. And so they provide us a great shopping guide. That brings us relevantly to toxins and talking about the contribution of a variety of environmental carcinogens to cancer. And I love this image here because it really breaks out some of the particular toxins with the cancers that they're associated with. So you can see that, for example, let's say you're stuck in traffic behind a truck that's putting out a whole bunch of fumes. You're going to be breathing what's called polycyclic aromatic hydrocarbons, and those are associated with lung cancer. Other elements of interest, pesticides are associated with leukemia and lymphoma. And childhood leukemia is also associated with motor vehicle exhaust. And we talked a little bit earlier about nitrates and nitrites from meat. Those are associated with colorectal cancer, leukemia, and lymphoma. Another source of nitrates and nitrites is in drinking water, particularly when that drinking water is contaminated by agricultural runoff, because the main way that nitrates and nitrites come into our world is when they're used as fertilizer in conventional farming. For people who are interested in environmental ethics and living in a way that doesn't add more cancer burden to our brothers and sisters on this planet, this is another place where organic agriculture makes a wonderful contribution, because when we have our plant fertilizers coming from natural manures and cover cropping and reusing plant material, then we're putting beneficial things into the water stream instead of these concentrated and cancer-causing nitrates and nitrites. And one of our readers is asking to see the chart again with cancers and the percentages that are diet related, so I'll track back to that in a minute, and then we'll come back to toxins. So there's that slide, Jeannie. And for anybody who's interested in particularly going into more depth in some of these slides and understanding them, I would strongly encourage you to look up the work of Dr. Agarwal, and that reference was cited earlier on in the talk. So Gail asks, where are these charts available? And they are actually available if you get the full text version of Dr. Agarwal's paper. I give him all the credit for developing these wonderful diagrams. So I'm going to go ahead now back to toxins. And here we are with that. And we're going to go into greater detail on toxins, both how they affect you and also what you can do about it. Because again, there's a lot of good news here about how you can get empowered to understand your own ability to detoxify, the way that your genetics are involved in that, and the way that you can then moderate those genetics through lifestyle factors and diet as well. And Janice is asking about the spelling of Dr. Agarwal. And his last name is Agarwal. And I'll go back to the slide with the paper that these diagrams are coming from. Give me just a moment to pull up that page. Okay, so on this slide here at the bottom, you can see where it says Pharmaceutical Research, Volume 25, Number 9, September 2000. It's either 2008 or 2009. If you plug that into, if anybody knows how to use PubMed, if you go on Google, put in PubMed. PubMed is the free and pretty much universal database for all medical science research that gets published. So if you put that citation in there, that'll pull up the abstract for Dr. Agarwal's paper. Depending on the access that you have, you may be able to then get the full text for free. For example, if your workplace offers full paper access, otherwise you can often purchase the paper for a reasonable fee. So I'd encourage you to check that out. Okay, and Janice types in that a slide isn't available for viewing. Janice, if you could give a little bit more specific information, I can help you with that. Okay, so let's go on back to toxins. And all of these slides will be available through Dr. David and Cherie's service through handouts. So I encourage you, if you'd like more detail on any of those slides, to contact them and order handouts after this talk. Okay, so we were talking about toxins, and let's get a little bit more specific about that. So In terms of toxins, there are several different types. We have air pollution, and we talked a little bit about the polycyclic aromatic hydrocarbons, and these can get into the lungs and affect us, particularly if the hydrocarbons are bound to carbon, as they are in air pollution. They penetrate the lungs more effectively. Other toxins, you may have read the fact that indoor air, that is the air in our homes and in our workplaces, has worse air quality than even outdoor air does. And a lot of that has to do with our furnishings. So the formaldehyde that's in pressboard furniture and mattresses, also the volatile organic compounds that are in carpets and carpet glues and in paint, all of those things can affect you. And so you may want to read up more on the condition called sick building syndrome and how that relates. Indoor air pollution in particularly is linked to childhood leukemia and lymphoma. And pesticides, as we talked about with the organic foods, are linked to certain specific tumors such as brain tumors and some of the rarer conditions such as Ewing's sarcoma. And pesticides, of course, go beyond just what you eat personally. Understand that there's quite a bit of pesticide runoff into our water supply. And so I encourage you to check out on my website, which is newpathtohealth.net. I have some great entertaining videos called The Meatrix. It's like the Matrix, but the word meat. And they talk about the contribution of conventional farming to our health, and particularly about agriculture related to meat production and dairy. And I think you'll be very interested there in pesticides and how many pounds of pesticides get put into our water every year through conventional agriculture. And so when you are choosing to eat organic food, to eat lower on the food chain, a more plant-based diet, you are making compassionate choices on behalf of all of our brothers and sisters on this planet and reducing their cancer risk. Gail asked for the website again to access the Matrix and other resources. It is the name of my business, which is newpathtohealth.net. So continuing on with toxins, we had talked a little bit about dioxins in food, and dioxins come from many places. We talked about bleach paper, and one place you might not think about is bleached tampons. And of course, one can only imagine the impact of having dioxins in such an intimate and sensitive place. Many of my patients, for that reason, choose to go with more ecologically sound options, such as the Keeper, which is a product made from medical grade medical grade rubber, and it's reusable as well, so a wonderfully sound option both for your health and the planet. Other things that happen, water pollution from the paper industry, and so again, the products that we choose to buy have a significant impact on each other and on our children. Also from trash incineration, which is a controversial practice in certain communities. And all of these dioxins are linked to increased risks of sarcoma, which is a very aggressive and difficult to treat cancer, and also to lymphoma. Radiation as a toxin is something we'll talk about more in detail, especially since it's been controversial in the current news lately with the airport scanners. Radon is linked to lung cancer, and that's something that is going to be community specific. Places that have radon are ones where there is solid rock bedrock under the ground. And so if you Google your community, you can pretty easily find out if radon is a significant risk in your community, and if needed, you can have your home assessed for it. What would happen then is an environmental consultant would come and take air samples from your basement or crawl space. And it is something that can be remediated if you do have a radon problem in your home. Sunlight, I think most people are familiar with sunlight and its contribution to both cancer cause and cancer prevention. The portions of sunlight that are most damaging to the skin are the UVB, think B for burn, and UVC, think C for cancer, whereas UVA contributes more to aging. What's interesting about sunlight is that you're much safer with frequent brief exposure than with periodic high-dose exposure. So better to get out in the garden for half an hour a day. You're going to get your vitamin D, you're going to get the benefits of sun, as opposed to going to the beach twice a year and getting a real intense burn. Then finally, high voltage power lines have a pretty strong link with cancer, particularly leukemia and lymphoma. And this is impacted by how close you are to the high voltage power lines. Even a few hundred feet can make a big difference. And so I encourage my patients when they're shopping for a home to own or rent to take a close look at that. And perhaps if they can, avoid being within a few hundred yards of a high voltage power line. Let's talk a little bit more about toxins and genes, since this conversation began with a talk about how much of cancer is genetic and clarifying what we really mean by genetic, the difference between inheritable genetic conditions versus non-inheritable ones. And one thing that's particularly interesting is the role of something called single nucleotide polymorphisms, or SNPs. So inherited genes do affect your ability to process environmental toxins. Because each of us has inherited some of these SNPs. They are variations in the genes that regulate liver detoxification. These genes are particularly interesting because it is very common to have one or more SNPs. Most people do. There's a great deal of diversity, so your SNPs are likely to be different than even your sister or brother's SNPs. And the impact on your health is more subtle. So, for example, genetic conditions then with significant impact on your health, like say Huntington's disease, those are what's called low prevalence, not very common, high penetrance, that is that they make a big impact in your health. SNPs are high prevalence, that is they're very, very common, with low penetrance, that is their expression in your life and your health is more subtle. So let's talk a little bit about some of those SNPs. For people who would like more detail about how liver toxin metabolism affects your health, I'd encourage you to check out the antioxidant and chemotherapy talk that I gave a few weeks ago. It's available through Dr. David's library. We go into, in that talk, great detail about how the liver works and impacts your detoxification. A few things that might tip you off to thinking that it may be worthwhile to explore your SNPs. Now, a few things. One would be if you're very sensitive to caffeine, cannot tolerate even a small amount of caffeine without noticing significant impact in perhaps anxiety or headache or irritability. That may express a SNP in a particular cytochrome called 1A2, because that's the one that metabolizes caffeine. Next, if you're particularly sensitive to perfumes or petrochemicals, that can sometimes be consistent with a variation in cytochrome 1B1. And then for people who just can't unwind or relax, maybe you had a disagreement with your boss this morning, and even now it's hard to let it go. Maybe at the end of the workday it's hard to come home and unwind. Those people sometimes that is more of an issue of psychology and counseling and attitude. Interestingly, though, sometimes it actually is a matter of liver metabolism. The liver metabolizes your catecholamines. Those are your stress hormones that tell you to fight or flee. And the enzyme that breaks down those catecholamines so that you can get rid of them and stop reliving that stress is called COMT. It's an acronym for catecholamine O-methyltransferase. And so some people who just can't unwind or relax may actually have a genetic variation in this liver enzyme. Now, why do we care about this if it were the case that the genes are just what you get and there's nothing you can do about it? Well, you can do things about it. For example, something as simple as eating a lot of broccoli can change the activity of some of these enzymes. The toxins that you're exposed to will change it. Whether or not you choose to drink caffeine will change the induction of some of these enzymes. And if you want more information about enzyme induction and what that means, again, I encourage you to check out the antioxidant and chemotherapy talk. So there's a lot of benefit that can be done here to improve your overall health, to help you detoxify, potentially for cancer prevention, because some of these cytochromes are involved in metabolizing toxins that could otherwise be carcinogenic. And so the good news is that you can work with a naturopathic doctor in your community to do some targeted testing which can identify your particular detoxy genome, your SNPs, and then develop an individualized prevention plan. And for a qualified naturopathic physician in your area, I'd encourage you to check out the website of the American Association of Naturopathic Physicians. And Gail asks if I'm saying that broccoli is beneficial, and yes, we're going to talk quite a bit about broccoli in this conversation. So right now, let's talk a little bit about radiation and airports. Several of my patients do fly for their treatment, and they've been asking about the new scanners in airports. And some of the concern has been raised by some scientists and physicians out of the University of California at San Francisco, asking for this to be explored further. So how these body scanners work is that they put a dose of radiation that is primarily focused at the surface of the skin. It's called the backscatter, and the goal of this is to be able to see anything that might be going on at the surface of your skin. For example, if you were carrying a weapon or other inappropriate item into the airport. Now, a lot of the messaging around this that's gone out has pointed out that the whole body dose of radiation from this body scanner is minimal, comparable to just a few minutes of flying in the air. And so from that perspective, we've been encouraged to not be concerned about these scanners. Now, what's interesting from the scientists at the University of California at San Francisco, that they point out that that calculation of whole body dose is true if the radiation is focused generally throughout the whole body. However, the dose of radiation is concentrated at the level of the skin. And so there's concern for impact on organs in that area that then get a much higher relative net dose of radiation. So that would be the skin, thinking about melanoma, basal cell carcinoma, the breasts, and the testes. And also then concern for special populations such as the children, the elderly, cancer survivors. And so I encourage you to check out the link at the bottom of this page. It shares the letter from the scientists at the University of California at San Francisco, and they explore these issues in greater depth. Then Gail asks about the accumulation of different types of radiation on a daily basis, and I do think that that's something to be aware of and concerned as well. In relation to the airport scanners, this has come up about pilots, for example, and the fact that they may have pilots and other flight personnel are exposed to radiation, cosmic radiation from being at altitude each time that they fly, and then as well from the airport scanners, and there may be some concerns of cumulative effect. I think that's something to look into. Interestingly, on the other end, there are some data to suggest that regular low-dose radiation may be beneficial. And if you'd like to take an interesting dive down a rabbit hole of knowledge, check out the phrase radiation hormesis, the second word spelled H-O-R-M-E-S-I-S. So that completes our conversation about toxins and radiation. And the next key factor to talk about is inflammation. And inflammation acts as a mediator or a central waypoint between many of the carcinogens that we've talked about and between those natural agents that are chemopreventive. We talked about inflammation in discussing obesity. And one of the key chemical messengers in the body that regulates inflammation, you can see on that diagram there it says NF. That's short for NF-kappa beta. And so you'll read in a lot of the natural medicine studies on cancer prevention or what's called chemoprevention, they'll look at the role of NF-kappa beta. And one of our participants asked for the spelling of hormesis, as in radiation hormesis, and that is H-O-R-M-E-S-I-S. So inflammation, let's talk about that a little bit more. There's a very interesting theory that may be applicable to certain cancer types, that cancer may develop as an unhealed wound. That is, that we start out with healthy cells that undergo some kind of damage. It could be inflammation, could be injury. The body then goes about trying to repair that. And the concern arises that if there is ongoing tissue damage, ongoing inflammation, then there are repeated attempts at repair, and that in those attempts at repair, that genetic damage can occur because, of course, with that rapid repair, the genome may not be copied effectively. There may be errors, and there may be new cells produced that don't have their DNA completely intact. The evidence for this theory is most compelling in the case of colon cancer. And if you look at the progression of colon cancer, it goes in a stepwise progression from healthy tissue to precancerous lesion to cancer. And that's why getting colonoscopies is so important, because in a colonoscopy, often unhealthy tissue or colon polyps can be found, removed, and you successfully then prevented the progression from that polyp to a cancer. And in many cases, that's a gradual stepwise progression, so you do have quite a bit of time to get in there and catch that polyp and remove it. In particularly colon cancer progression and progression of some other cancer types, that NF-kappa beta that we talked about has a key role, and as does inflammation. Now, one very powerful piece of evidence in this relates to a colon condition that is known to significantly increase the risk of developing colon cancer. There is an inherited genetic condition on that slide called familial adenomatous polyposis coli, or FAP. People who have this condition progress very rapidly to colon cancer, often developing colon cancer by their 20s or 30s. And so in this population, there was a study that looked at the impact of anti-inflammatories on the progression of polyps in these cases, and they found benefit. And what was particularly interesting, they compared the efficacy of the drug Celebrex or celecoxib, which is a COX-specific COX-2 inhibitor, to the herb turmeric, and actually found that the turmeric was more effective than the Celebrex in this small clinical trial of reversing the development of polyps in these people who were at very, very high risk for colon cancer. There was recently, on the topic of anti-inflammatories, also a study that came out looking at the potential benefit of aspirin in colon cancer prevention. I think it's something worth looking at. Particularly interesting, though, if you look at the studies, is what's called the number needed to treat, or NNT. That's the question of how many people have to take aspirin in order to prevent one case of colon cancer. And then similar to that, you look at the number needed to harm, that is, how many people have to take aspirin in order to have a severe adverse event, just such as a GI bleed. And what they found is that the numbers are about the same. That is, you get about one GI bleed for every case of colon cancer that you prevent. Now, of course, some people might point out and say, well, a GI bleed is very treatable in many cases and maybe less serious than a case of colon cancer. However, I think we do need to consider that, certainly with aspirin and its benefits, and that you have to treat several hundreds of people with aspirin in order to prevent one case of colon cancer. Whereas turmeric, with a much better harm profile, might be something worth looking at. So on that topic, let's talk more about protecting your family from cancer. We've talked about the dangers to avoid. We've empowered you to take a look at really talking to friends and coworkers about smoking and the harm that it has with second or third-hand smoke. We've talked about radiation and its impact on you. We've discussed toxins and diet and obesity and those things. Now let's talk about the good things that you can do for you and your family. And we're going to start with Mother Nature's prescription kit. And what the information shows us about nature's wisdom is that it may be that approximately 30 to 40% of cancer cases worldwide would be preventable by feasible dietary means. I encourage you to check out that link there for the Diet and Cancer Report. And another study of the U.S. in the 1980s found that 75 to 80% of cancer cases could have been prevented by lifestyle changes. That's a very empowering set of numbers. Protecting your family. This is Nature's Physician's Desk Reference. Just as if you look at images from the PDR Physician's Desk Reference, they have lots of boxes with brightly colored pills. Well, check this out. This is Nature's version. I love it. And this comes again from Dr. Agarwal's charts. We're going to go into each of these food categories in more detail and what it does for your health. Excuse me for just a moment. So talking a little bit more about Nature's Pharmacy, let's start with the backbone of fruits and vegetables. And the encouraging news there that there's more than 25,000 different phytochemicals that have potential for cancer prevention, acting on multiple cell signaling pathways that are involved in cancer development. Some of the major compounds that we'll talk about that are from fruits and vegetables will include the carotenoids, vitamins, resveratrol, quercetin, sulforaphane, and indole-3-carbinol. And so our guests who asked about broccoli will go into that more particularly with the sulforaphane and indole-3-carbinol. And then the next piece in Nature's Pharmacy is quercetin. Quercetin is a dietary flavonoid that's present in quite a few fruits, vegetables, and beverages, so it's a very easy thing to get in your diet. And it has very powerful effects: antioxidant, anti-inflammatory, induces apoptosis, which is the programmed cell destruction of tumor cells, and anti-proliferative, that is, decreasing the replication of unhealthy cells. Of interest, kind of tangentially related non-cancer conditions, quercetin also can help to stabilize allergies and asthma, and so many of my patients get good improvement with those conditions with doing something as simple as eating the white pith on their citrus fruit whenever they have citrus. And that's a great source of quercetin. Quercetin is known to block activation of NF-kappa beta, and that's highlighted there, and we talked about that as a key cellular messenger in inflammation. And interestingly, there's also been a clinical trial, that's something done in people, a phase 1 trial, looking at the fact that quercetin orally administered was able to inhibit the tyrosine kinase activity of lymphocytes. Now you might ask, well, why do I care about that? Tyrosine kinases are proteins that are involved in cancer cell development. Many of the cutting edge and very expensive anti-cancer drugs right now act on tyrosine kinases. Examples of those drugs are erlotinib, also called Tarceva, and Herceptin, also called trastuzumab. And these are drugs that can cost, $10,000 or more a month to take. And so the good news is that we may have the potential to get at least some tyrosine kinase blocking activity in lymphocytes, that may be particularly relevant for lymphoma patients, with something as affordable and simple as quercetin. Next, resveratrol, certainly been in the news quite a bit, is something that is going to be in your red and purple and blue foods, and does have anti-cancer properties in early studies, that is in vitro and animal studies in a variety of cancers highlighted there. And something very interesting about resveratrol is the dose-response relationship. So we had talked earlier about radiation hormesis, and there's that word there. What hormesis means is that you can get opposite effects based on the dose. So we talked about that with radiation, clearly higher doses cause cancer. There's some preliminary research to suggest that very low doses may be anti-cancer. That's something that's in the early stages of research. It's interesting now in resveratrol that we're looking at possibly a similar effect. It may help to explain why some of the resveratrol studies lately have not been showing as much benefit as we would have expected. And so based on this research, I encourage my patients to get their resveratrol through their food rather than taking it as supplements until we know more about this biphasic dose response and perhaps what the optimal dose is. Gail had asked about broccoli, and here's some more information on that. So brassica family vegetables, that's your broccoli, cabbage, Brussels sprout, cauliflower, and daikon artichoke, are wonderful anti-cancer foods. They modulate nuclear transcription factors, which then are the things that activate the changing of the use of your genetic material to make proteins, proteins being the instruction book that then tells your body what to do. So nuclear transcription factors sit at a pivotal position in determining whether or not an unhealthy cell can activate and become a cancer cell. I3C also acts on liver detoxification in phase 1 and phase 2 to metabolize and eliminate carcinogens, particularly the estrogens, and so these brassica vegetables are being looked at quite a bit in terms of breast cancer prevention and breast cancer care. For more detail about the phase 1 and phase 2 enzymes, I'd encourage you to watch my presentation on antioxidants and chemotherapy because we do go into quite a bit of detail with that. Gloria asks about foods that contain resveratrol. Those are going to be your fruits and vegetables and beverages that have the colors of red, purple, or blue. So berries, grapes are going to be good sources, red wine as well. Also, eggplant would be another good source of resveratrol. Okay, so let's talk more about broccoli. We talked about I3C, and now I want to talk about sulforaphane, which is another ingredient present in broccoli and its role in chemoprevention. And there's some very, very provocative information out about sulforaphane. And so one thing is in clinical trial, there was a small trial done where sulforaphane was given to women before they underwent breast surgery. In this case, it was elective surgery for women who were choosing to have breast reductions. And they looked at the activation of certain enzymes within the breast tissue and found some information that confirmed a possible anti-cancer effect of sulforaphane. The other really intriguing information has to do with how sulforaphane may target breast cancer stem cells. And in my previous talk, the antioxidant chemotherapy talk, we spoke about stem cells and how they may be potentially really at the root of why cancer recurs despite effective chemotherapy. And the thought that there may be stem cell activity there, which chemotherapy and radiation are often not able to destroy those stem cells. And so I'd encourage you to check out this article about how broccoli extract can target those cancer stem cells, and you'll find a link there to my website with more information. I'd encourage you to check that out. I have several great articles on the website related to stem cells and medicine. Okay. And let me reposition our slides here. Give me just a moment. Bear with me for just a moment. Okay, so here we are back at broccoli extract. And now we're going to talk about spices and condiments. And on the left here, pictures of many of these, and on the right, some descriptions of them. So we're going to talk about spices, things like fennel, turmeric, garlic, ginger, green tea as well. Then, so first I want to talk about tea. Green tea, black tea, white tea. It all comes from the same plant, which is the Camellia sinensis plant, and the color, whether it's green or black or white, is based on whether or how the tea is fermented. And so I've got some data highlighted here for you in terms of many different cancer types that are impacted by tea and by catechins, which are one of the active components within the tea. So you can see some activity in cancers as diverse as cervical, prostate, and hepatic. And there's some information there at the bottom on dosing and the amount of green tea that may be safely consumed potentially. And I did in my last talk, the antioxidants and chemotherapy, talk about the fact that there are some situations in which we have to exercise prudence in the use of green tea. In fact, there are particular therapeutic medications used in cancer care that do not work well with green tea. So I encourage you to check that out. And if you've been following the science news lately, there's been a bit of interesting new information and potentially confusing information about green tea. There was recently a large epidemiologic study done in China that followed the amount of green tea that women were drinking and new cases of breast cancer. And they found no protective benefit of drinking green tea in terms of breast cancer. And you can read the study there. I gave you the link to the study, so I'd encourage you to check that out. And then at the bottom, once you read that study, to check out the discussion from our wise naturopathic physician, Dr. Lise Altschuler. She's the author of the Alternative Medicine Definitive Guide to Cancer, now in its 3rd edition. I encourage you to check out that book. It's a wonderful resource. And also to look at her website here. She has some good information about this breast cancer study. And one of the really interesting points that Dr. Altschuler brings up is the potential impact of green tea consumption based on the overall dietary consumption of flavonoids. That is, that the population who were studied in this trial were a group of women who were already consuming a very high flavonoid plant-based diet. And so from that dietary perspective, they were at very low risk of breast cancer to begin with. And so she raises the provocative question about, is it that green tea may be of better benefit or greater benefit to people who have a lower overall dietary flavonoid intake and a higher risk of breast cancer than those who are already so low risk that additional consumption of green tea may not make a difference. Check out her website and the comments. I think you'll find it very interesting. Next is curcumin, which is something that Dr. Agarwal and his lab at MD Anderson in Texas are really international experts on. They've done extensive research into the impact of curcumin on cancer and found that it has anti-cancer effects or potential effects in a variety of tumor types. And these clippings here show some of the preliminary clinical trials done with this, as well as some of the animal and in vitro data. So I'd encourage you to look at that further in your handouts. And then garlic. We talked about garlic in the last talk in relation to chemotherapy metabolism. In relation to cancer prevention, garlic does have multiple anti-cancer effects, particularly through modulating glutathione. And so before leaping to, for example, buying supplemental glutathione with its expense and its challenges of absorption, you might look into simply enjoying foods that help your body to make its own glutathione as it's designed to do, and garlic is wonderful for that. And then a really interesting one that came up in Dr. Agarwal's research is fennel. And there was a very interesting trial done by Lamb in which they gave a population of current smokers with bronchial dysplasia. That's a precancerous condition for lung cancer. And they gave them one of the active compounds from fennel and found that it did help to reverse that bronchial dysplasia, that pre-lung cancer condition. And so certainly my preference if somebody's smoking would be to help them quit. However, as adjuncts with that, I think fennel is a very interesting thing to look at. And then finally, looking at the whole grains, the cereals, these are going to be our grains and legumes. There are several interesting anti-cancer effects here. We're going to look at soy in more depth as well. And so with our whole grains, we have several anti-cancer potential activities. First of all, whole grains are going to be high in insoluble fibers, and the intestine then ferments these insoluble fibers. It helps to balance the microbes in the gut towards more healthy ones, and these healthy microbes make butyrate, which is the preferred food for the cells that line the colon. And so that's really the best way to feed a plump and healthy colon cell is by feeding it lots of insoluble fiber that it can make that butyrate. We're also learning more and more about the impact of healthy gut bacteria on cancer risk and a variety of other health conditions. Fiber also helps to balance the glucose and insulin response, and provides the whole grains provide antioxidants and flavonoids. And so that brings us to a conversation about soy. I know that the issue of soy and cancer is a very complex and confusing one. We do have information fairly clearly that says that soy may be protective in certain cancer types such as prostate cancer and lymphoma. Also in cancer care can be beneficial, for example, in prostate cancer as a radiation sensitizer or something that helps radiation to work better. And where the complexity of soy comes up is with breast cancer. And so the recent thinking has been to avoid soy in breast or ovarian cancers that are ER or PR positive, that is, if they have active estrogen receptors or progesterone receptors. And that's generally been the advice that most patients have received. Now, there's been some provocative new data that was published in the Journal of the American Medical Association last year that looked at a large cohort of breast cancer survivors in Shanghai, China, and found that in these people, soy intake decreased cancer recurrence. So I'd encourage you, here's the reference for the JAMA article is here. I'd encourage you to pull that up and read it and make your own determinations about what to do. You know, when my patients ask questions about what to do about soy, a lot of what I do for them is walk them through the research and help them to make their own decision, because fundamentally we have evidence to guide us. We don't have clear and absolute answers, and so it is a personal decision that needs to be made based on the evidence. And so we asked them the question about what happens when soy meets girl. And Dr. Donald Abrams, who's the president of the Society for Integrative Oncology, has some wonderful points to make in response to this Journal of the Medical Association article. And he talks about the nature of cohort studies, which are what these studies on soy all are, and how we can interpret them, recognizing the difficulty of doing a diet-based gold standard trial that is randomized, double-blind, placebo-controlled. Basically, people would have to eat pills all day long. And he comes to some interesting conclusions, noting that many of the thought leaders in this community are concluding that soy foods are probably a fine thing for women with breast cancer to eat. He considers discouraging isoflavone supplementation because it's a more potent phytoestrogen, and encourages people to look at less processed soy products, the traditional soy products such as edamame and tofu and miso, rather than the heavily processed soy items of the use of soy to make fake meat or fake cheese. I would add to that, considering looking at the level of genetic modification of the soy, and so organic soy, which is usually by law not genetically modified, may be strongly preferable to genetically modified soy. That research is an ongoing question, and some of the more recent animal study research is very interesting in what they're finding is that the consumption of genetically modified foods increases cancer risk not in the being that eats it, but in subsequent generations, the children and grandchildren. And so I think we have to really ask ourselves hard questions as we consider eating or using genetically modified foods. And so to wrap up our conversation about whole grains, Gloria asks about which whole grains are more recommended. And that's going to involve a couple of factors, certainly the nutrient quality, the level or lack of contamination of the grain, and then also food sensitivities. And on all fronts, the grain quinoa is an excellent one. It's very high in protein and minerals. It tends not to be contaminated with a lot of pesticides, and doesn't tend to be involved in food intolerances such as gluten sensitivity or wheat sensitivity. So that's a wonderful one to look at. For those who are able to tolerate gluten, kamut is a more ancient form of wheat, very high in nutrients out of the rices. The black rice, which actually has as much antioxidants or as good of an ORAC score as blueberries do. So you can really save some money sometimes on your antioxidants there. And certainly brown rice is preferable to white rice. What I really encourage my patients to do is to explore the whole rainbow of whole grains. There are so many wonderful whole grains that we don't ever need to be bored with good, healthy foods. So I'd encourage you to check out the bulk bins at your local health food store and get a sampling of lots of different grains that you're not sensitive to, and enjoy those in great variety. Next, I want to talk about vitamins, and many of these are going to be present best in our whole foods. And this slide talks about particularly some of the vitamins that are most clearly established in terms of cancer chemoprevention, vitamins C, D, and E. And we talked about E being wonderfully present in whole grains, and vitamin C, of course, in our fruits and vegetables. So to get these vitamins, we can do that very easily through our whole foods. Next, I want to talk specifically about vitamin D. And we talked about how vitamin D is what's called a nuclear transcription factor, so it's going to regulate genetic expression in terms of cancer formation. And there's been some interesting and controversial information come out lately from the Institute of Medicine about vitamin D. The Institute of Medicine is a quasi-governmental group. They're involved with the government, but they're a privately funded group. And they came out with a recommendation saying everybody pretty much from age 1 to age 70 should only take 600 international units of vitamin D. Now that's an increase from their previous recommendation of 400, but it's a very small one, and they're advising against anything higher than 600 international units. Now, the controversy about this, folks from the Vitamin D Council in particular were asking questions about what about all of the research regarding benefits of higher doses of vitamin D. Some of the caveats with the Institute of Medicine study is that this group focused really solely on the data related to the minimum dose of vitamin D needed for bone integrity so that people don't get rickets. They ignored all of the data and expert testimony that they received regarding the impact of vitamin D on cancer, autoimmunity, and a variety of other conditions. There also have been some concerns that have come up regarding possible corporate influence in relation to a new prescription vitamin D analog drug that will be coming out soon. So I'd invite you to do some research and join the conversation. I've provided a link here at the bottom that gives some more information about that. And please do continue to submit questions as things arise. Finally, to talk about cancer protective behaviors, fasting is something that has very interesting data regarding both anti-aging effects and anti-cancer effects. And we can observe anthropologically that virtually all traditional cultures practice some form of ritual fasting or calorie restriction. And so fasting has been studied in animal models and been found to be anti-inflammatory, to decrease things that stimulate cancer growth, such as that IGF-1 or insulin-like growth factor 1, and very interestingly, in mice, to be protective against radiation-induced tumors. And so one wonders if a good time to fast might be when you go to the airport. And I hope you enjoy this comic in relation to that. There's certainly been a lot of controversy and discussion lately about the airline scanners and their relation to healthcare. And so on a little bit more serious note, you actually might consider if there are times when your body's going to be substantially exposed to carcinogens, that might be a good time to have a brief fast. And Janice asks to see the vitamin D slide again. And here is that at the bottom of the page where it says join the conversation. And again, I'd encourage you, these slides will all be available via handout through Dr. David after the talk if you'd like to get more information. So I'll leave that slide up here for just a minute so that you can copy it down. Okay, and then continuing our conversation about things to protect your family from cancer, physical activity, of course, is key. And that's something that everybody knows. The pieces that might be new is the level of impact. And so I think this clipping may be of particular interest to you, talking about the impact on breast cancer and prostate cancer and colon cancer in terms of exercise. A particular interest, I think, is also not only that can physical activity impact you developing a cancer, but it can also impact how aggressive or how dangerous that cancer is. In colon cancer, one of the things that significantly affects both how aggressive the cancer is and what treatment options are is something called the KRAS mutation. That's a genetic mutation in the cancer. And what was found was that people who were less physically active and had larger bodies, larger body mass index, were much more likely to have a KRAS mutation, and with that giving them a more aggressive form of colon cancer. Physical activity does also modulate cancer growth signals such as insulin resistance and IGF-1 and estrogen levels that we've talked about before. So I would encourage you to protect your family by getting moving. And that can be as simple as going for a walk after dinner. I like to talk with my patients about the fact that we're discussing physical activity or activity program, not exercise. That is, that they don't need to go to the gym and lift weights and work really hard if they're already worn out. That something as simple as taking a 10-minute walk after dinner, or choosing to have a walking meeting with clients at work rather than sitting in a desk can be beneficial. So we can conclude from this conversation that cancer is often preventable, and that the tools for prevention are readily available, affordable, and achievable, and that nature provides us with the pharmacy to do this and also with the blueprint, the guide on how to proceed. So we're very blessed. And I hope that you've enjoyed this talk, and if you have, I'd like to give you some resources on more information. Particularly, I think you'll love my newsletter because in that newsletter we go into more depth on topical and new cutting-edge information on natural health and cancer prevention and other health topics. And there's a link there where you can sign up to that newsletter. And that newsletter gets sent out monthly. You'd also welcome to join the conversation on Facebook, and I've given you a link there, or on Twitter. And if you have topics that you'd like to explore more, I'd encourage you to post those on Facebook and share ideas on things that you'd like to see in our Ask the Doctor column or in future lectures as well, or newsletter topics. So thank you so much for joining me, and thank you for your questions. It's been a pleasure talking with you tonight. If you have more questions, please contact me via my website there. If you'd like to connect with a qualified naturopathic oncologist in your area, I encourage you to check out the Oncology Association of Naturopathic Physicians. And I'm going to click back now to the place where you can connect and communicate if you have further questions. Thank you so much, and have a blessed night.